they don't tell you about myofunctional therapy is that it can be incredibly valuable and yet still not simple. You may be a parent or a prospective patient wondering, why is this out of pocket? Why does it cost that much? Is this actually going to work? What do I really have to do to get it to work, if anything? Or you might be a clinician wondering, should I become a myofunctional therapist? What kind of certification do I need? What's the best route to start? Can this actually make money, or is it just an expensive hobby? Well, today I'm answering both honestly and 100% without any fluff. First half is for the public. And so if you are looking to understand and get all the answers to if this is something that's really going to be beneficial for you and should you invest in it, that's the first half of this lecture. The second half of this lecture is for potential future therapists, people who are wondering, should I become a myofunctional therapist? And what's the best route to go so I don't waste too much money and actually get a return on my investment? I am so happy to have you here with me today. I am your Myo best friend. I'm Carice Laguerre. For those of you who are new, I am here on a regular basis giving all sorts of, let's call it reality checks about myofunctional therapy for professionals and for the public every now and then. And it is incredibly important that for free information to live and to thrive, and for others to be inspired that this is actually a path that they should take too, that they need to be offering as much free education as possible for both sides, because there's not enough of it out there besides short bursts on social media. We've got to keep this going. So, like, comment, give me a hi, hello in the comments. Let me know what part is the most impactful for you, or subscribe if you're watching on YouTube. If you're watching on LinkedIn, comment, connect with me, and you'll be in the loop for all future education. All right, like I promised, this first part is all about the practitioners. All about the patients. The practitioners, you just have just a little bit of a wait. I promise you will be addressed. All right. So, myofunctional therapy, you might be wondering, if you're a prospective patient, what exactly is this? There's like loose explanations. There's some exercises or something that I think I have to learn, or if I do these exercises, is this like mewing? What exactly is this? If I bought a jaw exerciser, is that like the same thing as myofunctional therapy? No. The answer to all of that is that myo is not at all anything that you think it is, and it's more often than not what it is purported out there to be. A lot of people will put it out there on social media for like quick, snappy attention. It is just some exercises. You do the program, yay, magically you're fixed. And that's just not the reality of it. I like to compare myofunctional therapy to personal training, which is why we have this picture up here. It is really having a guide who is there to help you strengthen and coordinate all the muscles that nobody ever thinks about, all the muscles below your eyes to above your shoulders. We're helping to work those muscles so that you can have optimal overall wellness, breathing, sleep, dental health and wellness. It's an abundance of things, okay? It's not a replacement for anything, and it is not merely just exercises. Exercises are really phase one of everything that we do with myofunctional therapy. Then we graduate to coordinating musculature, where we start to assemble and disassemble, actually. So we're assembling how they should work and disassembling any recruitment or compensatory patterns. And it looks more like activities. We use a lot more tools. It's a lot of repetition. Then we get into the phase that is the most important, phase three. If your myofunctional therapist is not integrating things into your daily life, you will not be able to sustain your outcomes. If you don't hit phase three, that's it. You might as well just continue mewing for the rest of your life, but you won't get good outcomes with that either. Okay. So while we're not a replacement for anything, we do work really, really well in conjunction with a lot of other specialties, because I think the best way to really understand myofunctional therapy is that we're dealing with the soft tissue pressures that really do influence in a great way your dental and most of your craniofacial features. So we know for a fact that when you do apply physical pressure, you can make a change to your physical features, like thumb suckers. So, thumb suckers, we have known forever. If you suck a pacifier for too long, if the child sits with a sippy cup in between their lips all the time, you're going to have an alteration in the dental alignment, right? But it's not even just the teeth. The teeth are not floating in the mouth on their own. The teeth are within bone, and that bone impacts other bones. And so we have that grounded knowledge in that we can use pressures to alter physical features. And why I have this kid picking his nose is because more recently, and I've loved that this has come out more and that there are more physicians that are talking about this, ENTs that are talking about this, who are saying that yes, if you do use a finger to go digging up your nose, you can over time influence how that is shaped. You're changing the cartilage, you're altering and creating an alteration. And so, what we want to do is we want to now have those pressures work in your favor as opposed to working against you. So, we're going for an optimal outcome here, okay? These are some fun TikToks. I don't know if you've seen them at all. Let me see if this is going to come up here. Why is my TikTok not playing?
Is it true that picking your nose makes it bigger?
Yes. If you actually pick your nose, you can start to push your septal cartilage over and you can start to reshape the lower lateral cartilages. You won't move the bone, but you'll actually create more space, at least on one side.
Craziness.
Is it true some people inherit a deviated septum?
No,
No.
you can inherit a lot of qualities, and some of the qualities may be that you have crappy nasal function and you have allergies, and the allergies cause you to breathe through your mouth, and that actually causes you to have a narrow palate that pushes up, and that pushes the septum to the side. All that to say, most deviated septums are not because of genetics explicitly or because of trauma, but instead because the tongue is not on the roof of the mouth, allowing for normal palate, midface, and nasal development.
Shout out to Honesty. I love it. This is a great channel you should follow. I think I've been following them for some time, and so I'm really excited that there are people who are out there sharing this knowledge. Now, he's not the only one. There are a lot of other people who are sharing the knowledge. It's just fast and quippy when he does it, so I love it. Okay, so we've known this for a long time, and I think that's the biggest part to remember. A lot of people are like, oh, myofunctional therapy, it's so new. No, the term myofunctional therapy was coined even before 1920. In the early 1900s, we started research in the dental field to understand what is going on with malocclusion when teeth are not in the proper positions. What's going on with crowding, and why are people some having ideal occlusion and some are not? And this really trickled down over decades and well over a century to where we got this study in 1981. Now, this study is not, it's great for what we've gotten to learn, but it's not the most friendly if you're an animal person like I am. But we learned a lot, right? So we know that genetically we have a lot of ties to various monkey species. Rhesus monkeys are among those. A normal, typical rhesus monkey is pictured in the image here. And so you'll see that typically they have big, broad noses, lips are closed, and so forth. However, what they did was they took baby rhesus monkeys, plugged their noses so that they had to be mouth breathers, obligate mouth breathers. The babies weren't just going to suffocate and die, and that's not what happens to most of us, right? If our noses are congested, we don't just suffocate and pass away. We do actually then just default to mouth breathing. So that's what happened. They left them mouth breathing for a period of time, and then they noticed that even when they unplugged the noses, that they maintained poorer tongue posture that was low and forward, that they developed malocclusion that otherwise wouldn't naturally be present at all. So the teeth were changing the shapes, the dental arches were not as broad and wide, and that their noses became more flat and their nostrils a lot more collapsed in appearance. This is not new information. It's just being presented more because now finally we have more people who are talking about this and the impact that physiology and pressures do have on our bodies. So, with that in mind, what does all this have to do with myofunctional therapy? You might be wondering, like, are you on a tangent, girl? I do get on my tangents, but this is not a tangent. Back to the physical pressures, our tongue exerts an intraoral pressure, and our lips and cheeks present an extraoral pressures, and these have to be balanced. They are a check and balanced system. You can't have your tongue exerting too much of a pressure and not enough pressure so you've got your lips open, not enough pressure externally. You can't have your lips closed and your tongue down low, not creating the proper pressure that would support the floor of the nose, the maxilla. That maxillary bone is the roof of the mouth, which is also the floor of the nose. These have to be balanced pressures. And myofunctional therapy teaches all the muscles to do exactly what they need to do to stay and retain with the constant light, soft pressures at rest. At rest. Yes, we do deal with muscles and how they work during certain tasks and activities in daily life, chewing, swallowing, speaking, so forth. However, it's primarily at rest where those soft tissue pressures make the most impact. And so, everything that we're doing is in repatterning those muscles and how they work. And when we look at that, I really need you to think about it as a long term commitment because that's really what you are dedicating yourself to if you're going to sign up for a myofunctional therapy program. Like I said, I compare it to personal training. So let's say I had a goal of getting six-pack abs. Now, I'm already not starting in ideal weight. So I've got to lose weight and then get six-pack abs, right? So let's imagine that now they're practicing in a way where they're going to now teach me lifestyle changes because I need to change up my diet. 60 to 70% of the effort is in the daily life choices that accompany you, right? Diet, I need to be active and move more. I need to lose weight, and then we can build up muscle and define, or we build up muscle while we're losing weight. They're creating a custom plan for me that would look different if I was someone else, if I had a different body type, if I had different genetic predispositions, I would have a program that would look entirely different from somebody who weighed 50 pounds more than me and somebody who weighed 50 pounds less. It's not going to be the same because we're not coming in at the same level. It's also not going to be the same because I have certain deficits that might be specific to me and my body. Like I do really great core exercises. I can hold my core really strong and well. I love a good core exercise. I could plank with the best of them, right? But if you ask me to do something where my triceps have to be involved and I have to push something back with my arm, oh no. My triceps, terrible. Biceps, good. And so these are things that you wouldn't know by looking at me. You're not going to look at me and be like, hey, if you do bicep curls, you're going to lose a bunch of weight and everything's going to be great. That's what it would be like to just mew and do one singular thing or a set of singular tasks that's not specific to you and your body and your deficits and or your strengths, and it doesn't account for all the lifestyle changes that you would have to make. We know that if I was to go work with a personal trainer and I want to see change, I have to commit to doing this over a long period of time. It's not going to happen overnight that I would get six-pack abs. It probably might not happen in 6 months. I might be looking at least 9 to 12 months to start seeing a lot of the changes that I really would love to notice, right? And this is daily effort and commitment. I have to make proper choices daily. I have to really commit myself to this in the long run. The same thing exists with myofunctional therapy. You've got to commit to it for at least a 6 to 9 month period of time. Now, if you go to the myospot.com, you're going to see you're 90 days away from change. Yes, at least within the first less than 90 days is very, very typical. But at least within the first 3 months, I'm hearing, if not once, certainly twice, that there are changes, that people are starting to see the shift and change. And just like with personal training, if I was trying to get six pack abs, 3 months from now, I might start noticing, oh man, I've lost XYZ amount of weight. Ooh, I really feel my muscles when I'm exercising. Like you start to notice these shifts. But it's not until you keep going that you get to your end goal, right? So you've got to be willing to commit for that lengthy period of time, because muscle change doesn't happen any differently in the muscles you don't think about than it happens in all the muscles shoulders down that we all think about. Okay. So it's not just the muscles that you would have on the beach exposed, it's the muscles you have exposed pretty much all the time that require that same level of dedication and commitment. So you're planning to be a part of a myofunctional therapy program that is ideally very unique and customized to you. You should know and deeply understand before you start a myofunctional therapy program what your deficits are, because you would have had a comprehensive evaluation. If the therapist is not offering you that and they just want to start distributing you exercises, that is a giant red flag. A giant red flag. You should know and understand where your deficiencies, what exactly do they plan to work on, how is this custom to you, and what will your commitment and time frame of commitment look like. And if you can commit to it, I promise you it creates life changing outcomes and results. I always try not to share too much of my patients, even when you go on my website. I've been doing this. I've been in this field and adjacent to this field for 12 years, but really deeply practicing for roughly 10 we're coming on. And I can't tell you how many lives, working with hundreds of people, so many lives change, but you'll rarely see the people's pictures and photographs because I really value the privacy of it. I don't have my kids all the way out there with all sorts of things, and so I don't want to overshare. But here's an example, because I think proof is in the pudding is always a very good thing to follow, a very good rule to follow, right? A very good example, a preteen boy who had a severe jaw incident. Like, it's like chewing on one of those hard gum candies, and then you just mess up your jaw, and you go to see all of the people, all of the specialists. Your physician sends you one place to a physical therapist, your dentist sends you to a TMJ specialist, and everybody's got their own ways and thinking of how they can address this, but nobody's actually looking at the constant function that is actually a part of things. And so if you freeze to read, you'll see some of this beautiful, note that was written by this patient's mother. But we worked together, and with the commitment, they were able to see real impactful change. We're able to make changes in the bite and bite positioning, always with some help. Now, sometimes they're post orthodontics and they've already done the treatments. They're clear aligners, or they're brackets and arch wires, or they're expanders. And so we're just helping to retain and sustain, or other times, not necessarily. Sometimes we're helping to just create memories that they will be able to garner forever. When I met this amazing young lady, she was 13 or 14 at the time. I want to say 14 or 15. 14. I want to say 14 at the time. And so in that period of time, her whole life had this crooked smile that nobody could figure out. Had MRIs, CAT scans, went to see different neurologists. Is this a nerve problem? Is this a muscular problem? PT and done all sorts of things. And one day the dentist was like, why don't you try myofunctional therapy? Like, maybe that'll help. Now, this was a 2-year case, but the difference in the smile, the difference in the confidence, this is somebody who would talk to you like this with their mouth covered, or would smile or laugh with their mouth covered, who was so confident and so beautiful and really was able to shine through once they, were able to no longer experience the discomfort of not having balanced facial musculature. This beautiful little girl, mom had never seen her really smile before. Everything was like this awkward smile, and I know because I had one of those types of kids that had like that very like awkward like they just look uncomfortable, not necessarily like they're smiling. And was so happy to share with me the kindergarten pictures once they had actually developed a smile. There's so many things that myofunctional therapy can actually be helpful for, things that you would know by seeing pictures, and many things that you probably wouldn't even notice by looking at a photograph, whether it's oral facial pain or TMJ, TMD problems, being able to sleep better. You'll never catch that in a photograph, right? Establishing nasal breathing, the just difference between a lip open and a lip closed picture could be as much as telling them to close their lips. And so sometimes some of these changes, the life changes, they're not immediately visible, but they are still very much there. Myo can help in so many ways. People who have gum disease, periodontal disease, tongue ties, pre and post, body posture, neck and shoulder pain, they might have any number of things. Honestly, there's so many things. GI issues. We help with a lot. Hormone balancing, like cardiac problems. There's so many things that myofunctional therapy can be very, very impactful for. It's just really important that you get a hold of a myofunctional therapist to have a deeper conversation. But even when you do, they should always be telling you that they're just one piece of a much larger puzzle. We don't replace any sort of medical care. The orthodontics, we are not a replacement. You're like, oh, I don't want my kid to have braces. Okay, that's great. I don't want your kid to have braces either, but I can't guarantee that. I'm just helping with the tongue posture. And what we've got in tongue posture, hopefully we're able to achieve a difference in, their craniofacial development and outcome. That way we are working alongside an orthodontist in the future if it's necessary. We're working with pulmonologists or sleep physicians. We're working with ENTs pre and post op. We're working with oral surgeons pre and post op. We are doing a lot of work with speech therapists, with occupational therapists, with feeding therapists, to really put pieces of the puzzle together that help for optimal function. And so it's incredibly important that you understand that we are not the end all be all for anything. So your team, when you're working with myofunctional therapy, can include any number of other professionals. You're not creating just an investment in your physical posture with your oral posture, I should say, and the soft tissue pressures in the cranial facial region. You are actually investing in a whole integrated approach. Okay. When one of us shines, all of us shine. Now, for the obvious elephant that is very much in the room, I understand that some of you may be coming to this video after having a consultation with a myofunctional therapist, after maybe having more than one, after going on Facebook or going on any other social media and reading comments about the high prices or fees that some people have paid to do myofunctional therapy and what they may have invested. Myofunctional therapy, you just have to understand that it's not recognized yet as an independent practice. If you do get insurance coverage for it, more often than not, it's really just a practitioner who can bill out for something else, like a physical therapy code, a speech therapy code, an occupational therapy code, whatever codes are able to bill out with that in mind. So just keep that in mind. That's incredibly important for everybody to remember, is that these are not things that are covered typically. Now, when we're thinking about insurance, I think it's important to know and remember what exactly insurance is. Insurance is a business. It is not in the business of paying out as many claims as possible. It is actually in the business of trying to grow and retain profits. So, yes, you pay into it. Yes, you want them to pay for all the services that you are deserved. And absolutely, myofunctional therapy should be a part of that. But I'll tell you that right now, with the way the field is, it's not standardized, it's not fully regulated. So there's a lot of questions you need to ask your myofunctional therapist to really and truly hone in on how well they'll be able to work with you. And that goes back to some of that individualization, their evaluation. What does that tell you about your dysfunction and how they're custom working with you? You should always have a consultation before you work with anyone. Whether or not you have to pay for that consultation is neither here nor there, but you should absolutely be on the lookout for, how knowledgeable they are in the field itself. But without regulation in the field, how would insurance know who's a competent provider that they should be reimbursing and who's not? How would insurance know how to dictate care when they don't fully understand it themselves? You may have just heard of myofunctional therapy. You think your insurance company heard of it? And if they haven't heard of it, you think they want to cover this thing they've never heard of? It's not, it's more often than not happening. We know what insurance is. We know how detrimental it can be to have them really as the drivers of care. And so anticipate that you will likely have to pay for your myofunctional therapy. Most practices are fee for service, and that's just what it is. I get it. What I love most is that the work I do, the people who can afford it and are have had conversations with me, have received my 5 to 7 pages of reports about them specifically and work with me. They understand, they're able to pay, they want to pay, they know they're going to get the result and the outcome. And that enables me to be able to be financially stable as a business owner enough that I can be flexible. Most myofunctional therapists are small businesses. And being small businesses, we are able to be reasonably flexible. Payment plans, having negotiated fees, abbreviated programs, being able to have alternatives for you, whether it's a self-guided course or a book recommendation, or giving you some tips and tricks during your consultation that might help you be better, or by sequencing your care, by saying, hey, this is where you really need to go first. I think if your primary care physician is able to write you a referral for a sleep study, or if you don't need that, and if you really need to negotiate through insurance and get to, am I a candidate for myofunctional therapy? Am I somebody who can actually breathe through my nose? Like, you're going to need to see a sleep physician. You're going to need to see an ENT. You're going to need to see a dentist. You're going to need to see a bunch of other people that can help you to sequence care. So you'll anticipate, and in the interim, while you're maybe saving up for it, while you're maybe trying to negotiate it, one of the biggest things that I've recently put out there is that I think it is absolutely fabulous when I'm able to negotiate, because other people do things, right? So I do myofunctional therapy. There are people who do landscaping. Like, I need a landscaper. If somebody comes up and is like, hey, like, I really need myofunctional therapy. I can't afford it though. How else can we work this out? I have a landscaping company. I'm willing to come. We'll come twice a week. We'll, cut the grass. We'll pull the weeds. We'll do whatever you need. Awesome. Let's do it. Let's work together. I would love that. An exchange of services, any type of exchange of services, I think, because everybody has a wheelhouse. If you're a bookkeeper and you know that this is a small business that could probably use a good bookkeeper, like, maybe you're doing that Myo in exchange for bookkeeping services. I think it's a good thing that Myo is as small as it is, because you can kind of finagle things where you need to. Most of us get into the field because We needed help ourselves. I got into myofunctional therapy incredibly selfishly because my four kids had issues. All four kids had issues that I couldn't afford to go pay somebody else to fix. So it was cheaper for me to take the class and to really like dive into it. And then once I got to the other side of it, I'm like, wow, these kids are night and day. Why don't more people know about this? Why is this like some hidden thing? Like, this shouldn't be hidden. We need to be talking about this. We need to be getting as many people on board and educated and help as many people as possible. And that's what drives me. So, where I can negotiate, where I can help to lower a fee, where I can offer a different type of resource, I do. And many, many, many therapists are like me, at least those who are worth their weight in gold. Okay. And just understand that you're going to have to be flexible with who you're interviewing. You might not get a myofunctional therapist who's in your area. You might work with somebody who is online. And that's okay, working with somebody who's online. There's really not much of a difference. Myofunctional therapy is not a hands on, like, let me manipulate your muscles for you. This is how you're going to get stronger. Mm-mm. As long as you can follow the cues, you should be able to get myofunctional therapy virtually without much of a problem at all. And so interview as many providers as possible. That way you can understand what your options are. And maybe there's somebody who works in a different part of the country where the cost of living is lower and they're able to charge less, and therefore you win. Okay. But either way, just anticipate that there is some cost involved, but you can be flexible. So, to sum up everything for the patients, myofunctional therapy is just like personal training. Okay, it's just like personal training for all the oral facial muscles, those muscles you never think about, and is often just a single solitary piece of a much larger puzzle. But it requires investment and commitment in order to achieve success. But the success is life changing, always life changing. Okay. Be well, find yourself a great myofunctional therapist. Now, for you healthcare providers who are listening in and who are like, ooh, man, I see it. Myofunctional therapy. Maybe you got some tidbits from there about how to talk to patients, how to describe it, how to really, explain that whole insurance thing. And you're like, ooh, man, I might want to actually become one of you guys. I might want to become a myofunctional therapist. I would meet you in when I first heard about that, I thought myofunctional therapy was the most exciting thing in the world. I was very excited to get into it, especially because I was trying to help my own kids. And so in getting into it, I'm like, this is great. And so many people get into it where it's so exciting. But I'll tell you that dental professionals, I am one, a licensed dental hygienist, but I I could not have anticipated how little resources were available at that time, and certainly now, if not for the 100 hours that I have freely available and like 60 plus hours of low cost education available. I'm telling you, the field looks exactly, almost exactly the same. It's pricey. There's so many people out there trying to, get you. And so we want to enter into this with caution, because yes, myo is so mentally stimulating, it is professionally stimulating, it is personally rewarding. It allows you to have deeper connections with the people you work with, deeper conversations, to have a bigger impact. You're able to be useful in a way that you didn't even realize was a thing before. And yes, it's very exciting, but I would caution you to temper some of your excitement. Okay. And with that caution, I'm just going to give you a little heads up, a little trigger warning here. Okay. I've been in this field for some time now. Okay. And I'll tell you that nothing gets people more riled up than the truth. Nothing. Okay. Truth will always stop scammers and charlatans from profiting, selling you hopes, dreams, and courses all wrapped up in a handbasket that is very expensive, promising you the world and really fulfilling in nothing. It's more often than not that they're just off with the wind onto their next cohort of people. And it just stops those who believe they are in positions of power, which there are none. The field is not big enough for there to be positions of power. There are barely any thought leaders, people who speak about this field differently, um, albeit apart from yours truly. But it stops those from who are in power from really remaining at their levels of comfort, where the field has gotten to such a level of mediocrity, where there is celebration for like the smallest of victories that in other fields would be so negligible as an accomplishment. And so that is where I'm coming to you from, because I'm all about empowering. I want as many people to be practicing this as proficiently and as profoundly as possible. And if that means that we're eliminating barriers such as finances, you should be able to understand and get education without having to invest exorbitant amounts when there's no regulation, no standardization. It just doesn't make sense. You need to be empowered to make the changes that I've fallen into the traps of, that many of my peers have fallen into the traps of. I need to get you with as many of your eyes and your sensors and your warners up and in alert, so that the field can grow and we can impact more people, because we really and truly do make an impact. But here's my intention today: I'm going to provide you with optimal clarity, minimal fluff. Okay, you can get fluff from literally anybody else who will sell you a hope and a dream. I'm not selling you a hope and a dream, I'm giving you the reality. Is myofunctional therapy worth it? I don't know. You're going to tell me at the end of this, okay? Because, I'm not coming with that, okay? So, we're going to start off hard and fast, hot and heavy, very hot and heavy. Myofunctional therapy is not a thing. It's not even a thing. People will tell you, oh, it's a profession. Oh, it's an adjunct of speech therapy. Oh, it can only be done by doctors. Oh, it's a whatever. Myo is not a thing within anybody's scope of practice. They will tell you, oh my gosh, it's in our state practice act and it's this, that, and the other. Yeah, it's in less than a handful of states have the assessment and treatment of orofacial myofunctional disorders in their scope of practice, right? With that being said, it doesn't inherently list myofunctional therapy as a profession. There's not enough evidence of myofunctional therapy even being effective. It's a pseudoscience. So for it to be in the scope anywhere, that would mean that it regulates other states who don't have it in scope. So there shouldn't be people practicing in the majority of the United States. And that's just not the reality. It's just not the reality. People will lie to you and will share with you because they just don't know any better. They repeat the lies that they've heard, that it is within their practice act. But it is not. And if it is, then we have to regulate. So, like, nobody in Montana or Wyoming or Wisconsin or California or whatever, you start naming states, I'll tell you there are 45 plus states where Myo should not be practiced if we're going to have the conversation about scope of practice, okay, by anyone, by literally anyone. And so you know that that's a falsity just based on that alone, okay? And New York State is not one where I have seen evidence of any sort of written regulation. And so I would love to see it, and I have lawyers that would love to challenge it. Myo is not a thing that has any sort of standardization. You're gonna go in, you're gonna want something like cookie cutter to follow to start. I would highly advise you against that. You don't want anything cookie cutter, because I wouldn't want anything cookie cutter. I would want to give to others what I would want. Like, it's cookie cutter. If it fits all, it fits none, really. If I can just do bicep curls and lose weight just doing bicep curls, then why don't we all just do bicep curls? It doesn't make sense. So it's not a thing. It doesn't have any standardization. It doesn't work in isolation. It is not going to be the magic cure all to everything. I know people will sell you that hope and dream, like, oh, you're going to help people so much with their airway. You're going to open airways and upper respiratory tracts, and you're going to help people with bam, 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 bam. No, you're going to help people fix their proper oral resting, their improper oral resting posture, and that is it. Point blank, period. Everything else is a happy accident that is a consequence of having proper oral resting posture, adjusting those soft tissues. I'm telling you, it does so much. It does so much. And we know that because we've seen it. We've seen it in practice. Nobody has to go do studies about thumb sucking and say, yes, it changes the teeth. We just know that because you can see that with your eyes, right? You see that, you know somebody who has that problem, you've seen it, you've seen how it's messed up their teeth, you can see a tongue thrust, and you can see how that's making an impact. Like, it's eminence based. We see it clinically, we just don't have documented evidence of it because the way that it is taught has no regulation, has zero regulation. Okay. Anybody can pick up, you could be watching this video for the first time, feel like you have enough information to create a 28-hour course, use AI to create such 28-hour course, take that 28-hour course, take that course directly to a certifying body, which really is not a thing, but take that there and they would accept it. There is no regulation to how, or standardization to how education is done in this field. So any sort of evidence, any sort of, and I've got videos of that on YouTube here, and I will link them at the end of this video, but any sort of evidence that people are trying to bring you on myofunctional therapy can be very quickly and easily debunked. So just deeply understand and know in your heart, and know with my full force telling you that for years, I am the sole income provider for my family of six. For years, as a myofunctional therapist alone, doing just myofunctional therapy, supporting my family. I'm telling you wholeheartedly, there is so much misguidance in this profession, but it can be rewarding. You just have to understand the limitations of it. And that's where all of that comes in. Okay. You have to know it. It's not easy. It's not easy to implement. This is typically what happens. Okay. You will go online, you're so excited about myofunctional therapy. You can't wait. What courses are out there? How are we going to do this? Yes. People start listing courses, people who you don't know how they practice, people who could have literally just gotten out of a course, people who could have taken that same AI created course that I just thought up in my brain and I don't doubt is actually out there, but that somebody just created, right? They could have just come out of that and be like, this is the best thing ever. This AI course. I've never had anything teach me so much. They have no evidence upon which they can say that they're on a ground that you want to be on. I love the people who give information, but where is your evidence? I would lead by saying, hey, I'm practicing myo full time. I do it and I make XYZ amount of money a year or annually. Even if you're just stating figures, I make 5 figures, 6 figures, I make 7 figures in my myofunctional therapy practice. I can tell you without a doubt that this course best prepared me. Like, that would be a really great recommendation. Question is that what you're trying to do? Are you trying to start your own whatever practice? Are you trying to implement it within a practice that you're currently in? Are you just trying to help a couple of people here and there, but you're not trying to get that overly invested? There are paths for all of that. Okay, there are paths for all of that. And I think I'm skipping ahead of myself because I'm really supposed to tell you what currently happens. But what really happens is you'll just pick a random course because somebody else told you to pick this course. Like, oh, do this course. Or you saw an ad and you're like, oh, I'm going to do this course. Then you'll struggle. You will struggle. It's not a course that may be ideal for you. The learning path is probably not ideal for you. You maybe don't have access to those materials as long as you would have liked. You maybe are too shy to ask questions in the way that you're able to ask questions. You probably don't get a one-on-one with your educator. You struggle. And then you spend more money because you're going to ask people, hey, I took a course, but I feel like I really need more. and you're going to get more recommendations. You're going to try to take that other course. It might not still be meant for you. You're over your head in on all of this. And so you're like, you know what I really need? I need to get certified because then I'll feel confident because you are a healthcare practitioner or you are somebody adjacent to healthcare, hopefully. Anybody can really practice myofunctional therapy. So don't let anybody tell you that there are limitations there. That's just not true. But you you want to be the best. And so, because you have a license in some field, because you're registered in some field, because you're structured in how you learn and educate, you're like, I need certification. And then you get certified. Then you realize that you don't really know any much more than you did before. Maybe you got a slight bit of mentorship out of it, but it really didn't do much for you. And you don't make any more money because of it. So you just spent a whole lot of money, and nowhere in that was you making money back or getting a return on your investment. And this is what I don't want to happen to you. And so, what I would suggest is that you don't buy education randomly, that you build a custom pathway for success. You have to, you have to, have to, have to. And you have a grain of salt on certification. Everybody always wants to know. I have so many opinions about certification. I'll tell you what, if there are any organizations telling you that they will protect you, or that if in the future it gets regulated, you're going to be protected because you have our certification, that is baloney. It's baloney. It's just not true. There's so much more I can say on that, but there's no legislation around myofunctional therapy. And if there ever was to become some, particularly because it's a lot of dental people who are always asking, but particularly for the dental people, whichever way makes the most money, whichever way is the most efficient for the practicing or owning dentist, that's going to be the way that it is written into a Dental State Practice Act. So anybody could do it. The hygienist could do it, the assistant can do it, front office team can do it. They can pull somebody, Sally Lou, off the street, and Sally Lou can do it. Anybody could do it because that would be the way that would be most profitable. And Lord forbid, we don't want to mess up profits, particularly when we know the growing rate of DSOs. There's no way that you think this little organization is going to protect you from big old dentistry, which is 10 to 20 times bigger than any organization in myofunctional therapy. So now that we've gotten that out of the way, I need you to know that not having a certification that is unified or regulated is not rare. This is not something that's brand new. You could be a sleep consultant that is certified. You could be a personal trainer that is certified. You could be a yoga instructor that is certified. There's no legislation around any of that. It doesn't mean anything. All of these bodies, none of them are accredited by the US Department of Education. Like, this is not really a thing. You're not certified in the way that like a plumber might be. It's not a real certification. It just means that you've met the standards of that teaching organization, which is awesome because it does demonstrate, yes, that you've met somebody's standards. Like, please meet a standard somewhere. But we don't know universally what those standards are. We don't know as a public, as other practitioners and professionals. I'll tell you, I've taken some courses and I can tell you which are great and which are bad, but I don't know what all of the courses that are out there, there's over 20. I don't know what all of the courses contain in content. I don't know who's AI generated, who's not. I don't know who's of substance and who's not because most people aren't out here on YouTube teaching for free so that I could see and I could say, "Oh yeah, you definitely sound like you know what you're doing and you've demonstrated that to me over hours of me watching you." We just don't have that. We don't have that aside from yours truly. So, can you practice without certification? Like the wonderful Sheree Whitfield once said on The Real Housewives of Atlanta, who gonna check me, boo? Who is gonna check you? Who is going to say, like, no, you can't practice? It's not a thing. It's not a thing. I know a lot of hygienists are really worried about it. You're afraid of losing your license. I'll tell you, losing your license isn't the end of the world. But also, it hasn't happened yet to literally any hygienist who has been called to a board, who's had things questioned. Like, it has not happened at all that somebody has lost their license for practicing myofunctional therapy, nor practicing it without a certification. So it's not a thing. Let me tell you what is out there and what's available. Okay. Calm, which is certified oral myologist. What is oral myology? Y'all let me know when you find out. AOMT. AOMT is the Academy of Oral Facial Myofunctional Therapy, and their AOMTC is their thing. CMT is the Feed the Peds. Oh no, she has a real name for it. Myo something. Y'all tell me in the comments what her business is. But Hallie Bulkins, certified myofunctional therapist. There's QOM, that's Neo Health Services, qualified oral-facial myologist. There's MAS, formerly of Airway Health Solutions, myofunctional airway specialist. That was like a whole bit of tea. There's tea behind that one. COMP, certified oral myofunctional practitioner, and there's AOMP. And I guarantee you more and more will come up. When somebody does come up with that AI course that I just talked about, they're going to add their own certification. And we won't know the difference between any of them. Because what do all of these mean? Drum roll, please. Nothing. Certificates might be like your starting spot. That might be where you feel like you need to start, but it does not in any way, shape, or form mean that you are a more qualified practitioner than somebody else who's been focused solely not on a certification, but on honing in on their clinical judgment, honing in on mentorship, and like really spending time, money, and investment on watching people, on talking to the people that they need to be with, on working collaboratively with different providers so that they understand what's going on that provider's end and how they can complement it. And they are superior to most people who are certified, because instead of focusing on one ideal of what a certification means and entails, they're focusing on them as a practitioner and how they can be the most impactful. And they should get all of the business in the world. They should get all the business in the world, because they can answer questions you never will if your only answer that you have to a question is, yes, I have a certification. Okay. So I would advise that if you're going to do it, start smart. Start, please, so smart. Identify how you want to be impactful. Like, what population do you currently work with? Is there a population that you would like to work with that you think might suit you better? Do you think that, you'd love to work with people, you have obstructive sleep apnea, and maybe you use myo to overcome it, and you want to work with others to help them overcome sleep apnea? You don't want to work with kids in ortho. You don't want to work with toddlers and eliminating habits. You don't want to work with, anybody else other than people who are in sleep apnea and really want help. Define where you want to be, because that's going to give you a laser focus on where exactly you need to be for education. Start looking into those things. With over 100 hours of education here on YouTube, I guarantee you I've talked about all these topics, maybe some of them more than once. Like, there are at least that as a baseline free resource. Just exploring this YouTube page as a baseline free resource will help you to hone in on, is this for me? What does it mean for Myo to be a part of a sleep program and team? What does it mean for Myo to be a part of ortho? What are the limitations in these things? How can I work with kids in Myo? What does that even mean to me and how I would practice? Are there ways to make this fun? What about those who are neurodivergent? What about those who are special needs? All of that exists on YouTube. I know, because I've created it. And it's not fluff. Just like this whole lecture so far, one fluff is not fluff. Okay. So start there. There are podcasts, there are articles, there's so many things you could be diving into for free. Your first step is never to go to social media and say, hey, what course did you guys take? No. Get some more education. Learn about whether or not this is for you, and then start seeking out those who exist in the space currently. This field ain't that big. Can you imagine if all you needed to do, if you wanted to be in the NBA, was look through a list of maybe 500 people, and on that list, you could talk to, rest in peace, Kobe, but if you knew you could talk to Kobe, if you knew you could talk to LeBron, if you knew you could talk to Michael Jordan and get their advice, what's their tidbits? What would they say? How could you devise your way to being like them? How can you be like Mike? How can you excel to these levels? Talk to them. They're not hard to find. Go in a group, ask, who do you admire that's practicing myofunctional therapy? And then I would even ask them, who do they admire? Like, I would keep going up the chain. There are people I admire, many people I admire in the field. Though my list changes as I meet people and I realize what some of their motives are, and some of their motives aren't 100% genuine. But like, I would ask as many people as possible, who do you admire? Who's your favorite? And you're going to get a quality list of probably less than 10 people. I would start reaching out to those 10 people. They might not all respond back. Some of them certainly will. They might not all respond back, but when they do, talk to them. Continue on. I've learned this, and this. What do you think about this? I would like to practice and do this. I would ask them every question I've ever wanted to ask somebody. It would just be amazing to sit down and talk to an MVP in Myo early on. I was blessed to be able to do that. Like, I had a Paula Fabi, and shout out to Paula, but I had a Paula Fabi at the start of my career. I had a Lois Laney. I had people I deeply admire, Kathy Winslow. Oh my gosh, so many. I had so many people that I deeply admire that I was able to really work with and to chat with and to learn from and to grow from. They're out there. They're out there. Talk to them. Don't start getting into any courses or, choosing a course until you've started implementing. There are lots of different tips and things that you could start to implement. Even if it's just a simple screening, implement something. Implement something. Find groups, even if they're just social groups, professional organizations that can help you, and develop your own framework around how you want to tackle. I'm going to do this all. I need to take a 3 or 4 day course. I'm going to take some time off of work. I'm going to go in and hard and fast. Where can I find that kind of course? Everybody will tell you where to find one. If you're like, no, I need time. I need to go slowly through it. I need to do it at my pace. There are courses that are at your pace, that are not cohorts, that you can get in whenever you feel like and work the program or go through the materials at your leisure with no limits to how long you have access. There are also some that exist where you have limits to how long you access, so you have to implement. But 100%, you've got to be able to navigate the field intelligently before you pick a course. Interview the instructor. Find out if you mesh with them. If you've never heard them lecture before, you don't know if you even like them, their teaching style, their personality until you've interviewed them. And if they don't have time to talk to you, or they want to charge you to talk to you, they want to charge you so that you can give them thousands of dollars, that's wild. Absolutely wild. Yes, their time is valuable, and that time would be recouped in fee when they buy the course. So if they don't have time to talk to you, that's a red flag. But interview all of the instructors. Okay. Myo may not make sense as your own independent business right away. You might want to start putting it into your clinical care currently, seeing if it's something that you even like talking about. There's a big problem with passion and, doing something that you love so that you never work a day in your life. There are plenty of days I love myo more than most. More than most. The amount of my life that I've dedicated to myofunctional therapy, I certainly do love it more than most. But what I will tell you is that there are days where I regret all my life's decisions, where I'm like, oh my gosh, it is just overwhelming. It becomes a lot. People will lean on you, they will rely on you, they will ask you question after question after question. You will have to utilize your brain all day long. You will have to really invest yourself in it. I'm so passionate, and more days than not I love it, but at some point it will become work. And if I could know whether or not I still want to push through before I even invested a dollar, I would want to know. And so that's why I tell you, having a business is not going to be easy. There's a lot of marketing and a lot of understanding that you need to really grow a business. I think a lot of airway and education around airway just literally circles airway and myo. And they try to teach you and teach you and teach you all types of things that you really genuinely do not need to know. You might need to understand them on the most baseline level so that you can have an intelligent conversation with your patient about it. But to attend webinar after webinar, conference after conference, or to do this, that, and the other, and like feel like you need to be a part of all the airway things, that's not going to help you grow your business. You will be stagnant. You will not get from 5 figures to 6 figures. You won't get from 6 figures to 7 figures. Like, you won't grow. And that's the problem. That's where we have the charlatans and the scammers and the people who don't want you to grow, because they have their own practices and they want their practices to grow. They're not looking to improve yours. So let me be the first person, before you have the practice, to help you improve your practice. Study business. It's not a get rich quick opportunity. Business is not easy. There are highs, there are lows. There's so much you have to save for and spend for. Like, find where all your expenses need to be before you even think about investing in having a business. You might want to do this as a part of your clinical practice first before you take on what could be the most challenging thing of your life. And understand that 70% of businesses fail. 70% of them. You might not be on the winning side of that 70%. Is it worth it? That's what you have to do, is figure out, is it worth it? Because your clinical skills alone are not going to create sustainability and profits over time. Okay. So it's not light work. It's not light work. With preparation and by designing or crafting or creating a path that is unique to you, myofunctional therapy is absolutely a valuable addition to your clinical knowledge. Like, I can't express to you enough how much I truly and deeply believe that in my soul, both for myself and through my experience, and in people that I have mentored and in people that I just admire. I know you can get there. It can be transformative and you can have a deeper impact on patients, but you have to start smart. You have to start smart. So start diving into information and education, okay? Just being here shows that you are one of the few who will excel, because you're taking these personal investments of time and allowing them to grow you, okay? So is Maya worth it? For the right person, with a set of expectations that are reasonable and fair, for the right provider, with also their own set of realistic expectations, absolutely. But myofunctional therapy is not cheap magic for patients, and it's not easy money for clinicians. It's a commitment overall on both ends. It's a process, it's a skill set, and when it's done well, it's a powerful part of improving function and overall quality of life. My friends, it has been nothing short of an honor to be here with you, to have shared this time with you, to have helped to be a part of your education. Don't let anyone else's broken system write your story in Myo. You've got this. Until the next live, I appreciate you. Bye, friends.